Hello, my name is Dr. Karen Hurley, and I'm a clinical psychologist at the Cleveland Clinic. It is my tremendous privilege to be presenting this talk this afternoon. And this is a talk that I have given several times before at previous FORCE conferences. It's the first time that I'm doing this virtually. And, it's a testament to, strange times in the sense that we do not get to be together. But at the same time, I'm grateful for the technology that makes this possible. So a little bit about me. I have specialized in hereditary cancer risk for over 20 years. And when I was looking for my dissertation topic, I was, as a graduate student, I was sitting in on research meetings when the BRCA1 and 2 genes had been, researchers had narrowed down on them, but had not yet developed testing that would be available at a clinical level for patients. But women who had first-degree relatives, a mom or a sister, or maybe a daughter who'd had ovarian cancer, were being advised to have their ovaries removed. And I thought to myself, how in the world does someone make a decision like that? So that became my dissertation and it became my life. And so here we are today, still talking about these questions. Genetics has changed very much since I was a graduate student. We've identified so many more mutations and genes that can have cancer-causing mutations, and FORCE has opened up to this larger community. But I find that the process of deciding, no matter what the decisions that have been put in front of you by your particular genetic risk, largely remain the same. So with that said, I want to take you through some of the psychological aspects of making big decisions that are posed by carrying a hereditary cancer risk mutation. So just before we begin, I have given a talk for Ambry in the past year, but I will not be speaking about any procedures or recommendations or medications in this talk, and any photos that you see do not depict actual patients. So sometimes let's start with the question, why make a decision? Why can't your physician just tell you what to do? And what we've learned over the years, both in research and also in me sitting in a psychotherapy room with many people over the years, is that if the decision does not come from you, it can actually foreclose on the mental processes that are going to carry you through not only making your decision, but dealing with how it turns out, right? So you may wind up with regrets if you rush through the process. You may sort of foreclose or inhibit any coping strategies that might help you with adjusting. And then, at the end of the day, if you make a decision, especially a surgical decision, and then things don't turn out the way that you want to, if you did it because your doctor told you to, then that can significantly disrupt your rapport with that doctor. And given that hereditary mutations, stay with you throughout life, that means that you will need to be engaged with healthcare system in an ongoing way. So this can have a ripple effect down the line for other decisions that you may need to make in the future. So I'd like to call this process the decision landscape, knowing the ups and downs, the pitfalls along the way, so that you're not surprised or taken aback by a seemingly simple question, what do you want to do? There is a full landscape to navigate on the way to getting to figuring out what's going to be best for you. One thing is that when you decide to get genetic testing, now maybe you've seen a genetic counselor and went through an extensive counseling process, or maybe your doctor said, "Hey, let's order this test," and the results came back. But that's typically only the first decision that you have to make, and then there is a whole cascade of other decisions that have to be made that maybe you don't realize you're taking on when you decide to get your genetic test result. It can range from fertility decisions, communication, talking with family members, or more granular aspects of risk-reducing surgeries. It's common to say that knowledge is power. And, one of the animating themes of this conference over the years is that knowledge is empowering. But at the same time, on the way to that feeling of empowerment, there may be feelings of being burdened, or that this is difficult knowledge to assimilate. So when we were in the previous slide, we talked about the cascade of testing. Some people describe it as an avalanche of additional decisions that you don't realize that you have to make. When you're trying to get help with your decisions, a barrier can be is that the risk information is highly technical, it's expressed in probabilities, and trying to explain this to, a partner, a family member, a coworker, much less a physician who doesn't normally deal in genetics, such as a primary care physician, can create a barrier in trying to get support in making your decision. Another thing that's really important is that your choices may not be in a vacuum. So suppose you have several siblings, a parent has tested positive, and now you're all making decisions about whether and when to get tested and how to manage your risk. Those decisions are going to be influenced by the decisions of other relatives, and vice versa. They may have opinions or feelings about what you are wanting to do. So one aspect of that probabilistic information, when somebody tells you you have a 1 in 2 chance of inheriting the mutation, 1 in 1,000 people or 1 in 300,000 people have this particular mutation, when you're that one, that changes your perception of the extent to which you are vulnerable to life events. We always think, things happen to other people, but once you get singled out for carrying a rare mutation, then sometimes people will develop ideas that they're particularly unlucky, or there's some reason that this happened to them. And then that winds up coloring their decisions and what they do next with their risk information. So it can be a very isolating experience to think of yourself as the one, but there are other things about genetic risks that are isolating that in turn make making decisions more difficult. For example, some of the choices that you may be offered may seem like science fiction. I remember first learning about CDH1 mutations and asking, really, you can live without a stomach? And trying to explain that and share that with other people and dealing with their reactions when you're trying to work through this can be very difficult. And similarly, the choices that you're presented with can seem very drastic. You also wind up starting to talk in an alphabet soup about all these different, genes and mutations and medications. And again, trying to explain this to other people and get them up to speed so they can support you can feel burdensome. Other people may either not know what to say, may feel overwhelmed, or that they've never had to make such a big decision, especially for people who are in young adulthood, where most of their peers are making decisions like about, getting married or education or jobs or, where to live, but haven't had to face, big medical decisions, again, that can separate you from your peers and feel isolating. A really important aspect of making decisions is that period before you've made your decision can be frustrating or uncomfortable. We like having a feeling of, I know what I'm going to do, but until you know what to do, that can leave you in a sense of limbo. So the thing is that sometimes people will be tempted to fast forward through that uncomfortable process and say, just take it, right? Whatever the, especially again with risk reducing surgeries. But there's a process of needing to be fully informed. And if you fast forward past that, that is a recipe for regret. One of my metaphors for this process is that a decision will gel or glide into place, or if you, kind of a cooking metaphor, if you're making a sauce and it needs to thicken and you stir it over and over and you keep thinking, this isn't working, it's still pretty runny. And then all of a sudden it turns over and then it achieves that consistency that you're looking for. A decision can be very much like that. Now, especially for those of you who got your genetic test result in the context of a cancer diagnosis. So maybe you got a colon cancer and you're only 28. And so they recommend that you have genetic testing. When people are dealing with a diagnosis, they often go into what I call battle mind, being very mission focused. Let's just get it done. So this mentality can help you get through treatment, but because of the nature of genetic risk decisions is that you need to think about not only the immediate cancer, but maybe risk to other organs or other decisions that need to be made that people with non-genetic cancers don't have to make. So therefore, that get it done mentality may shortchange you in the long run. Another thing is that when you have to make a big decision about, some aspect of cancer risk, is that it does require that you focus on yourself and that you be able to say what's important to you, how do you feel about this, and to be able to share that with, especially with your providers. So for some people, focusing on yourself is not kind of your, it's not what you do day to day. Some people are pretty socialized to focus on other people first, put them first, or maybe that's part of their professional identity. So parents are certainly prone to this. People who are in caretaking occupations, nurses, teachers, psychologists, people who are in rescue or protective occupations like police or firefighters, or if you grew up in a family where you had an ill parent or a parent passed away young, especially, which can happen in these hereditary cancer families, you may have had to put your own feelings aside to focus on what was going on in the family. If you were an oldest child and maybe, especially if there are a lot of siblings or big age spread, you may have become the little parent, which means that you had to focus on others. So being asked to sort of change your focus and put it back on yourself may feel awkward or even painful. Another thing is, none of the choices that you're being offered are ideal. You're hearing today and yesterday from many researchers who are working very hard to create better choices for people who have hereditary risk, but we have to work within what we have today. Now, 200 years ago, if someone got sick, you got leeches put on you. And so we're not in that situation anymore, but, we're limited by the historical context in which we live. And so, accepting that this is the best of what we have available can be helpful, but at the same time acknowledging that none of these choices are ideal and may not be something that anyone would want to do if they had to. So I like to think of decision making as a process, and defining 3 levels. So first of all, you need information. You need to collect the relevant facts and understand them. You need to deal with what it feels like to have to make this decision, and how does this fit into other things in life that are important to you that are going on. And lastly, do you have the support you need in order to actually carry out your decision? Sometimes I will see patients who, again, preparing for a risk-reducing surgery, and they say, okay, I know what I want to do, but who's going to be there for me while I'm recovering? So you have to have the action level kind of at least somewhat in place before a decision fully gels. So one of the things we want to avoid is having regret after surgery. So the main things that can prevent having regret is not having enough information beforehand about what it's going to feel like, how it's going to change your function, how long your recovery is going to be. People who are experiencing lots of depression beforehand can be at risk for regret. And carrying out a decision because the doctor told you to, not out of your own motivation, can set you up for regret afterwards. So in terms of gathering information, this scenario may look familiar to you. How many of you have been up, early, late, and in between, looking up things on the internet? One of the most important functions of this conference is to gather vetted information that has been looked over by experts in order to support good decision making, and to give you kind of a roadmap of how much information, what kinds of information you're going to need in order to make your decision. I think of this process as information hygiene, getting just enough information to give yourself a good decision, but to not overwhelm you. So one way to do this, I like to use the question, what is the one next thing you need to know? So going online, using well-informed sources, and then backing away from the computer, right? Getting off the computer and doing things that are going to help you feel empowered in other ways. Now, another thing, and this is, my experience in being in the therapy room with patients when they are going through a decision process, is that there will be emotions that enter the room that don't seem to fit. Why am I thinking about this past episode that happened a long time ago? That may be starting to get intrusive memories about a car accident that happened 10 years ago, or a different kind of a surgery that happened when very young. Is that stresses and decisions and traumas tend to echo back and forth between each other and can even amplify each other. And then added to that, any current stresses you're going may make things seem more difficult. So I've had patients come in who are high-level executives, very used to being decisive, and then they say, why can't I make this decision? And it's usually because there's something unresolved, maybe regret about a marriage that didn't go well, that is now echoing and undermining their belief in their own ability to make a good decision in the present. Another thing is that decisions about, especially about fertility or surgery can affect not only you, but a partner, in that our bodies are sovereign. We each inhabit our own bodies, but we also share our bodies, for example, in sexual intimacy. So so that one so there's this communication that can happen about how a decision is going to affect intimacy, how it's going to affect plans for the future. Partners sometimes struggle with feeling helpless while watching a loved one struggle with making a big hereditary risk decision. So a very particular dynamic that emerges, and this happens between couples, is when one person says, oh, would you love me if I decided to have the surgery? Would you still love me if I decided to have a double mastectomy, or if I decided to, have my colon removed and wear a bag? And so the partner feels pressure to be the Mensch, right? The good person. Of course, I'll love you no matter what I decide. Now, of course, the patient knows that the partner is under pressure to say that. So even if they say that, they don't necessarily trust it. And so then you wind up in this sort of communication spiral. So it's really important that even when a decision is right for you, is to help the partner feel a space for expressing feelings of anxiety or sadness. I love your body as it is, but and I'll miss the way it is, but I want you to do everything for your health. Those can be very poignant moments between a couple. Another thing that can happen is that if there are weaknesses in a relationship, if there are communication challenges, then a big decision like this can expose those. So everyday interactions may, you may get by with, communication more or less, but then a decision like this may bring out differences in values or goals that can be disconcerting. Another thing that can happen is people who have certain coping styles, such as keeping busy. Keeping busy is great as long as you're fully physically functioning. But in a situation where you've had a surgery, maybe you don't get to keep busy, and then that can expose underlying anxiety or depression. So it's really important when going through a major decision to seek social support. But bearing in mind, and this is, a particular challenge in hereditary cancer risk, is that your closest supports may also be majorly affected by your decision. We already looked at, that in the case of spouses, but sometimes someone's main support is a parent or a sibling who either is facing a similar decision, is feeling guilty that you have to make this decision because you inherited a mutation from them. So they may not, in this particular situation, be able to offer that neutral support that you need. So a guideline I use is, can you name at least one person who is neutral, who can listen to you without judging? But we do know from research that people who do not confide during stressful experiences, including these kinds of decisions, are at risk for prolonged distress in the long run. So a very particular situation can come up under stress, and especially, again, with surgery decisions. And that's when you're thinking about who's going to come and be there for the surgery, and you really want it to be, a parent, or, there's been tension in the family. Can't my father-in-law just this once put things aside because I really need them to, be there for me. There's a phrase from 12 Step that really applies in these situations. Don't go to the hardware store for oranges. So there may be people in your life who you really wish they could get it together just this once and be there for you. But if they're the hardware store, they're not going to get oranges no matter how much you need them to. So going a little deeper into the decision landscape is that these decisions are basically one way. Like once, especially again, the big surgery decisions, once you've decided to go ahead with a risk reducing surgery, that closes off alternate possibilities. And sometimes people are haunted by the fact, well, what if I do this surgery and then, I might have been one of those people who never gets cancer from this mutation. So this is something that can't be answered. You'll never know, right? So I think one of the challenges, and it took a while for me to realize this, is that these decisions which we're making in order to prolong your life as much as possible, give you as much quality of life as possible, have that same one-way quality as the outcome that we're trying to avoid, which is mortality due to cancer. So by making a decision that is otherwise empowering, somehow also brings mortality into the room and can stimulate anxiety. And this kind of accounts for what makes these decisions seem heavier than other big decisions than you've had to make in your life. And lastly, sometimes having to make a big decision will expose that someone has really not gotten the kind of support and development and encouragement that they need to be able to make big decisions, such as physical or verbal or sexual abuse. So being asked to make a big decision about what do you want may trigger very painful memories about having your will basically violated, where someone basically overrides what you might want. So given how heavy this all can go, it's been an ongoing privilege and quite remarkable to see how people do dig down and find that sense of resolution to figure out what's going to be right from them, apart from what might be right for other people. And this is really important, that you may encounter other people at the conference who are making similar decisions. But each person has to come to their own. So the antidote for this existential weight is meaning, understanding how your decision is going to fulfill your life goals. How does it connect you to other people? And how does it give you a sense of purpose? So basically, can you say in a sentence what your decision will do for you? So there are a few red flags. If you find yourself stuck on the question, just tell me what to do, stuck on the internet, preoccupied with, well, one doctor told me this, another one told me that. You're either crying a lot or want to cry but can't, or don't have someone to confide in. That's a time to seek professional help for your decision making. But you can be confident that you know you're making a good decision when you feel knowledgeable, you're informed, but you're not overloaded. You know what you're getting into. You've got a clear goal of what this is going to do for you, and you have the support to carry it out. So my take-home message with patients is always, how you make your decision is as important as what you decide, because that how is going to be what carries you through and helps you reduce the risk of regret. It is normal to be anxious, even if you've made the right decision, because, making change is not easy, right? But this is also an opportunity for growth, and it will help you put you on a good footing for having a good outcome from your decision, no matter the ups and downs that may come along the way into putting this in place. So with that, I would like to say thank you very much, and I wish you the very best for the rest of the conference and for your ongoing health.